everyone. Well, this is it. This is me back. I've had my operation. I'm feeling reasonably okay, actually. I'll just run through bits and bobs as I drift in and drift out of what's happened to me over the past 5-7 days, something like that. So I actually got out on Tuesday. Remember, this is bloodless surgery that I've had, so they were absolutely thrilled with the rapid progress that I made after the surgery. And that can be quite attributed to the fact that they didn't use blood, because my body didn't have to fight off any of the infections that come through blood transfusions that are given. So, yeah, as you can see, everything just now is exhausting me, talking and things like that. But it'll eventually free up, and I should get back to breathing properly again. Also, my heart rate is a rapid heart rate just now, and that should tend to settle down over the coming weeks as well. So last week, this time last week actually, I had my operation. It was actually a Thursday morning last week. It was a 6-hour operation. I went in on the night before, Wednesday, or the afternoon before, and there I saw Dr. Walker, and he was really reassuring that he's going to take his time with doing this surgery, make sure everything's sealed as he went, and lose as minimal blood as possible and do a fantastic job. And he certainly did. He's done that very well indeed. So Thursday, it was a 6-hour operation that it took them. They then kept me sedated for another 12 hours, and by time no, they did actually see me in high dependency unit, but by Friday night they were starting to move me back to the thoracic ward. So that was very good. Saturday morning I decided I would get out of bed and start my recovery, which I did do. So by the time I had guests come on Saturday, I was sitting by the side of my bed, and I was trying to act, hey, yay, hi. But wow, what an exhausting experience it was trying to talk to people. I couldn't remember what day it was, I couldn't remember what time it was. Just trying to think of a response back to someone, it was really exhausting. Even now, trying to think of a response and what to say here is quite taxing on my brain. Not that that takes much effort, but you know what I mean. But anyway, so sorry. So I'll just show you what I've ended up with. It's quite a big scar compared to what I had before, but before was when I was 9. So I'll just give you a little look. See how far that goes. So there you are. There's my fat tummy. But anyway, this bit right at the top feels quite hard. It's like a bony section, but that should go down, go away. And it comes all the way down to here. And then either side, there's 2 drainage holes, and this has just been put on today. And I've just had my stitches out of my drainage holes at the side there. So everything was fine. It's all healing up nicely. And I've just got to take it really easy. They're mentioning sort of 3 minutes walk a day, so like down to the bottom of the garden and back up. That's all you're supposed to do, even for someone like me. And you think to yourself, what? But if these people are saying it, then I'm gonna do it. They've done their part. They've done a really good job on me. Now it's up to me to make sure my recovery goes as best as I can get it. So that's that. It was really nerve-wracking on Wednesday night going in for the operation. You know, all the feelings that you have, will you survive, will you not survive, leave your family, all that sort of thing. But coming to a bit more compass mentis on Saturday, knowing that I had survived, was Very, very, very good feeling. And then all I wanted to do after that was get out of the hospital. All the nurses seemed to have snuffles and colds and stuff like that, and I could do without catching any of those sort of things. But anyway, my recovery was so good that by Tuesday I was let home. So my dad came for me and I got checked out, and we drove home. But the next day everything was absolutely aching because of all the jiggling in the car. It was a little bit unbelievable how much I was aching. But they sent me home with loads of painkillers and stuff like that, so they're looking after me well, which I'm pleased with. The surgeon put in the very latest valve, Sorin valve, I think it was, 21mm valve, which is supposed to be a lot quieter than the old versions. And as regards ticking, yeah, I can actually hear a ticking when I'm lying in bed at night in the base of my neck. But I think this is because I've got a lot of pressure there now as everything's just settling back down. But he reckons you should get used to it if you can hear it at all. So it's maybe even my imagination. Who knows? But if you're thinking that you'll come near me and hear me ticking, then I'm afraid you probably won't, because that's the first thing the kids did, you know, to come listening into my chest, see if they could hear a tick from my valve. But that didn't happen. But yes, very pleased with how it's going. I'm now on day 7. Today is day 7. Well, it's a full week since surgery today. So anyway, this is just to say that I am feeling tremendously better than what I was last week anyway. As regards to seeing if I feel any fitter or not, certainly not at anywhere near that stage. I've still got to sit down, rest, can't lift anything. Really take to heart the advice that the medical profession has given me with regard to making my recovery the best that I can. So that's the position we're at. Thanks very much to everyone that sent me cards and been interested and all that sort of thing. Thank you very much, and all your comments on Facebook and stuff. So it's been brilliant, and I'll keep you posted as I go through a few more days and see how I feel in a few weeks' time, if I'm any fitter, things like that. And then hopefully when it comes to full recovery, whether full recovery is full recovery or whether it isn't full recovery, you know, these things will cross at the time. But at the moment, bloodless surgery on the aorta valve has proved very successful, and at the moment I haven't been fighting off any other infection caused through having a blood transfusion, and that's the whole benefit through this type of surgery. The word gold standard, I heard, was bantered around the ward between the nurses and doctors, particularly when they were looking at my case. So whether they were thinking this is the standard that they want, whether it's too expensive of a standard, or whether the fact that you can get out. I was due to be in for 8 days, you see. That was the original. Dr. Walker says you'll be in for 8 days, and I was out in 5 days. So surely that saves some money in hospital resources, etc. But anyway, I'm going to leave it here for now because I'm just rambling and my brain's too tired to think. And thank you very much anyway for all your support. And I'm doing fine, and with Jehovah's blessing we'll get there. Goodbye for now.